Good morning, everybody. My name is Tembi. I come from Zimbabwe, but right now I live in DC, and I'm a health worker, and I'm here to tell the stories of health workers, mainly from the countries that I've worked in. I've worked in Uganda, I've worked some in Kenya, Tanzania, Malawi, Zimbabwe, of course, a little bit in South Africa, Swaziland, Lesotho. So I have shared experiences of health workers in all these countries. But I have had the fortune of working in the UK in very developed health systems, and I've also had the good fortune of working and interacting with health workers in the developing world. And it's those stories of the developing world that I'm going to share. I have witnessed the widening gap between those who have not. I've worked amongst high tech, medium tech, low tech, and zero technology. I have shared the frustrations, I've shared the despair, I've shared the desperation, and I've also shared the sadness of health workers who, in an effort to save lives, they find themselves helpless because they can't save lives. But I've also celebrated their successes, and I've also shared their hope that we can all make a better world. And it's those stories that I want to share, and examples. I have a lot of those stories, but I want to share a few of them since we are talking about innovation. I believe in innovation. I believe anything that can make the work of a health worker to save lives possible is great. And that's what we should strive for, to make a better world. I believe that we should set ourselves very high standards for an equal world, to give every mother, every child a chance for survival. I also believe that as a health worker, I'm a great conduit. If I believe, if I have conviction, if I have confidence that the great innovation will work, and work to make my work better, and work to save lives, I will sustain that innovation. And I also believe that as health workers, we are influenced by communities that we serve, just like we influence those communities. So I'm going to tell you stories of what I saw of innovations and where we think sometimes we fall short. Sometimes we fail to ask those questions of how are we going to get there? What difference can we make for the communities that we are trying to reach? And I'll tell the stories of, I once went to a health facility in Uganda, and I saw this midwife with a mobile phone. And I was so excited because I thought, well, we can send you messages, we can send you updates, and if you get into trouble, you can call for help. And she wasn't sharing the same enthusiasm with me, because that mobile phone had created additional problems for them. And she just gently said, you know, Tembi, we don't have electricity in this health facility. And I thought, uh-oh. And so she said, yes, we take the phones to the school to get charged. So we don't have them all the time. Somebody takes them to the school, somebody brings them in the evening. And I thought to myself much later, you know, there's so much sunshine in Africa. Why didn't somebody bring those kind of small solar panels, so that they could charge their phones? But when I was also saying that she could call somebody, I just thought to myself, you know, maybe was I expecting a 911 call, a 911 kind of response, because at the next level, there's probably nobody there. So I walked out of that health facility knowing that that mobile phone would not help that health worker. She really wasn't convinced that it had potential to make a difference to her work life. And I also remember working in Tanzania, and there was this nice big sterilizer, and it had been relegated into a storage container. And that was the worst part of it. And I said, you know, why aren't you using it? Because all you can do is load all your instruments and boil once. And I was told, you know, there is no water, just basic water. Because every morning they paid somebody from the community to bring water on a bicycle. And a bicycle can only take so much. It can only take maybe 2 or 3 gallons of 10-gallon containers of water. And that was all they had in that facility, about 20 to 30 gallons of water a day. And we were expecting hand washing. We were expecting that they would sterilize their equipment. We were expecting a lot out of them. And the other that is really dear to me, because as a midwife, I get very agitated, sometimes frustrated. Sometimes I also get haunted by maternal mortality and morbidity. We talk about it in the context of the MDGs. And I remember driving around all these rural areas and thinking to myself, you know, if any woman is pregnant here and she has a life-threatening complication, and this is their health facility, and she has to navigate the rough terrain, and she has to look for transport to come from the home to the facility, she's not going to make it. And maybe if she makes it to the facility, there's no health worker, or the health worker who is there doesn't have the skills to help her, or they don't have the drugs, or they don't have the equipment to even help her. And I always think maybe we can do better than that. How can we take the innovations that we are thinking of? How can we take the technology that we are thinking of, the technology we all take for granted, to help those people in those remote rural areas, in those urban slums that are sprouting all over, particularly in Africa and the rest of Asia, to help those health workers save lives. But like I said, despite all these challenges, we've also celebrated success. I have seen innovations work. I have celebrated just a difference in 1 month when a health facility, when a midwife said, you know, look, we haven't had anybody bleed the whole month, bleed excessively the whole month. And you think, are women supposed to bleed every time they have a baby? The answer is definitely no. And we know that the answer is no. And yet they celebrated that. They celebrated the difference, that innovation, that if you manage labor differently, you could cut down the postpartum bleeding. I've also celebrated, not very far from where my parents used to live, in the village. As I was driving, somebody stopped and said, hey, you know, there is now water at the clinic. And I thought, water at the clinic? Yeah, we got a handheld pump. They just received a handheld pump that brought water to the facility, and that made a very big difference to that community. And it was something to be shared and something to be celebrated. I remember in Malawi arriving and being shown a kind of a solar panel and being shown how it works with a lot of excitement from this clinical officer. And I listened, and then he said, you know what, right now we got a small fridge that came with this, with this solar panel. It means that we can control the temperature of the vaccines effectively. We can just set it and have the vaccines stored in optimal temperatures. And I thought maybe that's the first time they have confidence in the vaccines that they are giving. Really the first time, and what a difference that small solar panel made to that facility. It meant that obviously they will promote immunizations with a lot of confidence. And I also remember very recently, actually, when I was walking down in the streets, you know these people that always ask you the people that ask questions on the streets. A young woman approached me, and I thought, well, sometimes I don't stop to listen, but that day I stopped to listen because when they're young, I always think they're students, and I've been a student before. And she said, what would you do to change the world if you had all of a sudden supernatural powers? And I didn't hesitate. I said, you know, no woman, no child would die in this world of a preventable disease. And one of my colleagues said to me, all right, how will you do that? And I said, you know, there are a lot of good people out there. There are a lot of bright brains out there. There are people who have a passion to make a difference, to lead, to shake, to really make a big difference. So I started explaining about coming to SwitchPoint and coming to meet all these great people with their innovations. And I think she believed me, but a few minutes later, this young woman ran and said, you know, yes, Mama, you can save the world. And I come from Kenya. So I imagined her really believing that we can make a difference, believing that it doesn't really take supernatural powers. I think she internalized it and thought, yes, we can make a difference. And I think, yes, we can make a difference. All those of us that are here, when we are talking innovations, let's remember those health workers. Let's remember sometimes for them it's not big things, it's just basic things. It's basic things like water in a health facility. It's basic things like transport, to be able to transport their clients or their patients from A to Z. It's really also very basic things like electricity or energy in those facilities. It's also basic things like the mobile phone. I think we live right now, all of us here, and I think if I say everybody lift your hands, how many of you have one computer in your home? Maybe, how many have like 3, 4? There you are, right there. And there are still some health facilities and health systems, believe it or not, who still use those old cranking typewriters that go qua, and they do qua again and again. But that's not really what they're asking for. What they're asking for is very, very basic innovations that can help health workers make a difference, that can remove those moments of desperation, that can remove those moments of despair, and that can turn their working lives into lives of hope and belief that they can save lives. And on that note, thank you very much.